every time I smile, I remember you.
Oh,
I
great.
really,
Oh,
honest
that's
to God.
good, right? That's good.
Every time I smile.
Thank you.
The teeth I had were too long in front. That's why I was doing it. So I like them more
Shoulder.
straight across.
Got it.
Like this. But I think if I looked at these teeth, like this one looks a little long, it looks like an angle.
Perfect.
Okay, this one is okay. It also looks short compared, but
Yeah, this is long, this is longer, this is good. I think that was a good point. How's that? Okay, so this one is the final after all conversation with my patient, which is actually Dr. Joseph Caruso patient. And the day he came over here, so we discussed together regarding the opacity, regarding translucency enamels. As you saw, this is my lower teeth, and we more concentrate lower, but it's more brighter one. So we took the color here, which is M2, is too much translucency, but the value is really good. And here is the what I like, but to me it's too dark, so we're going to make it brighter, just like that. Just like upper, he mentioned it with a video, like this. He liked this because this is not much component, 2 colors of a component. However, so we made the better aesthetics. It's like lifelike restorations. Okay. There's a linger, contour, and form, and then trying to see the movement from the patients. So I don't have to make all this the contact, but this one is the finals. DC Cosmetic press. We fabricated all the way full contour for the linger. Okay. Then we finalize it the individual high-end restoration, which is people get from our study model. This is one by one. All right, this is the Cosmic press, which is high-end restoration from LSK 121. So we made the 66 anteriors cases. James would like to come by here. They would like to show us. They'll be awesome. So we're going to show you this my portrait. And then thanks for coming. Thank you. Come here.
thanks.
How-
Thank you
it's
very,
good?
very much. Excellent.
Thank you.
Everything's
Good,
excellent, superb work. All right, perfect. Yeah. The best kind of teeth I've felt in 20 years.
Oh, I haven't seen it in 20 years. You see here? What is that? Alright. So you like that one?
Yes.
Why do you like that one?
It looks great. It feels
Thank
great.
So-
It's perfect fit.
Uh-huh.
Everything on it is actually awesome. Just
Right.
completely perfect.
That's good.
I
And,
was amazed that when he puts them in, that they fit
Thank
just
you.
perfectly.
I appreciate it.
I know, I appreciate it. It's
So
perfect.
we-
I mean, it's perfect the very
Yeah.
first time. You put them in two at a time,
Uh-huh.
and when I close my teeth,
Uh-huh.
they fit perfectly.
Yeah.
There were no adjustments. So it really is, and they look.
Well, not only
the
that,
shading
I see the
and
dynamic.
everything.
Yeah, dynamic teeth.
Yes.
It's more natural, lifelike like that. Yeah. So I like the shape and contour I see. So we fabricated. So he and I discussed about. Did you remember how much we
Yes.
spent time, right?
Yes.
I'm not a doctor, by the way. We spent 15 minutes.
We
right?
talked, yes.
We just talk.
But you could tell you were observing everything.
From
I did.
his past history, right? He's a genius. He's retired very early, which is my dream.
Yes.
I couldn't do it. He did it, right? So, yeah, so grateful. Yeah, appreciate it. How long does it take to get here?
Yeah.
Thank you. You're fine. So I like the the shape and contour, and going up higher, and yep. Thank you. So a little bit here. All right. And this, I'm going a little bit more higher. Wow. Okay, what I like this, hold on, don't shake it, hold on. I like the deep translucency, okay? You see the between the teeth, which is our artistry. And not many people do just like the translucency with we put the membrane. We call the mamelon, okay? And a lot of people think, monolithic which is best. But only 10-20% dentists and laboratory technicians know about how important is layering with a fundamental design. That's why they can get a signature. And Dr. Caruso is paid the big money about dental laboratory, the restoration. It's not cheap.
Dr. Caruso is not cheap, but he's
Not
worth every penny.
Ah, nice. All right, so this video, not only appreciated, and then she told me, past his 60-year prosthodontist history. So we made a great crown restorations. So I would like to share with my people, my follower, the YouTuber, and the cosmetic is not the same. Everybody make the 6 unit, 10 unit, whatever, but it's not like this. I'm going to explain the why is difference. You saw my video. How can I take a custom color? And then Jim told me, and I don't know. He gave me a lot of information already. Then I explained them. So I'm trying to follow the lower, but it's more brighter teeth, right? And then we were going to make the golden proportion, right? Most likely is I see it's a light reflection, height of a contour, okay? Height of a contour, the side view, right? And translucency E, okay. Can you make the edge to edge like this? Like, you see? This kind of things, this makes me thrill, right? Compared to before and after, compared to maxillary and mandibular. And then he mentioned it, remember? I think he likes over there, right?
Mm-hmm.
The tooth. But I noticed that one is kind of a little bit monochromatic, but it's good bridge. But look at this, is our detail from the height of a contour, and then trying to create it in natural dentin color as much as possible. It's not mono, it's not zirconia, but this is made by Lisi ceramic. But we make the good fundamental, yes, hold on, good fundamental shape and contour. Move to, okay, you can relax, sorry, I'm sorry.
Right.
Okay, whenever he's tall, it's really good golden proportion, right? From the midline, little chin down, thank you. All right, so then when you just rest smile, then I like that. So regarding the cosmetic cases, which is what I like, that what I express myself. I'm not talking about Hollywood. I'm talking about the best cosmetic restorations. And like I said, you see a lot of YouTube video. By the way, thanks for the over 100,000, almost 110,000 right now. But they know the quality. The quality meaning, it's not like chiclet. It's not like the white. It's not like the mono zirconia. I know the big laboratory, they said mono zirconia is the best. That's really humiliating to me. It's my experience of over 32 years. I just pursuing about the natural as much as possible, compared to the patients, compared to the people, check the function, everything natural, make as much as possible. That's the case we had it, and then I'm trying to explain, and then I'm so glad we can shouting for all United States, not only that in the world. So we have to make the great prosthetic as much as possible than anybody. And then I know I do have a lot of followers, then they can follow what I'm saying, okay? So we can still apply our handwork, porcelain layer, size-wise, texture, loss of polish, they all put together our passion to the one patient, make him really happy. It's not like the white monochromatic, it's not like the piano tooth, it's these real cases, okay? So anyway, thanks for watching my video, and this is my outcome. So that's why I was like show you the before and after, so you can see my before while we take the color. And a lot of people are asking them when we make the video, right? Look, where's the finer? Okay, I don't have to say the finer, but I'm glad this patient want to come here. It is incredible. I said, come.
Every time I smile, I'll remember you. I
great.
really, honest
That's
to
good,
God,
right? That's good.
every time I see
Thank
him,
you. It's not only money, right?
And Dr. Caruso
It's
says,
not
like I
only
said,
money because,
we've known each other for 20 years now.
right. I mean, like you said, he's a rich guy, I would say, okay?
Alright.
But, money is nothing, but I just appreciated your time, your driving, your mileage. That's my concern, so I'm trying to share with you. It's not like, oh, okay, this guy's free to come. I'm not that kind of guy. But it's not big money.
Look, I like it because you're a nice person.
No, thank you. But
That's
you know,
one of the things. That's one of the things that's really important to me. That you're a nice person.
thank you. You know
And
what?
nice people deserve to be rewarded. You really have done an excellent job.
Awesome, thank you.
Not just excellent work, but it's really just perfect. I can't emphasize how perfect it is.
Thank you. And
And so it's so rare that things are done
that's right.
perfectly
That's
the first
right.
time.
That's right.
It is extremely rare.
That's
and
right.
You did it perfectly the very first
That's
time.
right. He
Thank you.
chooses signature cases.
And I think that's one of the reasons Dr. Caruso likes you so much.
Thank you. Thank you. So far, right?
No, I mean it. It shows. He really likes you. When you have your teeth done, you have them done at different times of your life, right? So you have a little, and they're never ever the same color when you put them in.
Yeah.
So that when I came in and had a bunch done, you had to select and say, this is what's going to match everything. And it really, you did an awesome job.
This is the fluorescence light, which is like I said, we are limited with fluorescence color. Okay, so natural teeth compared to top, but it's a pretty decent fluorescence light. Okay, that's what we got. Okay. Slightly open. Thank you. Photo. Okay. Photo. Down. Thank you. Do we choose from the ingot selection, and then multi-variety BT, BO, and we choose this. There's a lot of people want this bleaching like the white, so he doesn't like that. Remember, he wants the natural as possible. So we're using the B1 ingot, trying to match it, but definitely brighter than top. That's the story, okay? So that's why we fabricate that one regarding the material selection.
It's a little different. But then when I went side to side, they fit perfectly. And I said to him, I really don't see how you could do it. It's like it's done perfectly. That is so.
But you had a lot of concerning, you were questioning before why you do it, right?
Yes.
So now
You're very. I'm very comfortable.
thank you because
I'm tremendously comfortable.
no, you're right.
You know, Dr. Caruso has a high degree of confidence in you, so well. So I just even said to these gentlemen, they have.
Well, not only that, cosmetic is not. It's number one, it's not cheap money, and the number two is a pain involved. You know what I mean? They have to grinding, and the number three, uncertainty. So uncertainty from our age, I hate uncertainty. I really want. That's why I don't like lawyer. This guy all the time saying, "Oh, look, you will get. Okay, you will get what?
Everybody needs a job.
Charge me $10,000, but what is the final?" So he said, "Oh, you will get there. Get there." So that's why I don't like it. But I really like what I do, achieving for the final destination. Clearly, we arrived. So that's why we earn the business internationally. It's not like the local. I promise you. I give you beautiful. I said, what is a beautiful restoration? And patient doesn't know. How will they know? They think they know. So they look at the magazine.
That was the best part.
Right, they tear down.
When I said, you're the professional.
Yes.
I trust you.
Right.
You know.
Right.
I'll go with what you do.
That's right. That's why I explained to him what I'm trying to do.
And that's why it's so impressive that what you did is exactly.
Thank you.
Perfect.
Put a lot of. I see the inside of 1/3 is a lot of
translucency we mimicked it with the natural enamel. That's the beauty part. And I see the texture too still there. Non-touch it, proportion is right, everything's good. So which is what so here's the same things. Whenever I cook, right, I expect to cook exactly. So I told them, I need it well done. Don't give me the rare, right? Oh, I'm sorry, sir, I can give you a bag. So what are you doing, right? This kind of thing. How much I pay steak? Doesn't matter. Steak, I noticed the steak about $17, $12, $50, $100. Got it. Okay. What did I expect it? And can you give it to me? Then I'm happy. All right, charge me like I said. I mean, like you said, charge me, but show me your.
Never send your food back. They don't learn in that 10-minute frame how to do it right. No.
Right. So, but
They just
that's why
I go to restaurants. I used to go to restaurants all the time.
Right.
If they didn't do it right the first time, it's not going to get it right the second time.
Right, so same thing. So dental laboratory industry, same thing. Unfortunately, the technician, they just do same thing. They got $20, $15, $25, $30 for whatever. But same thing, it's a really sad part. So they said, I could do for you as long as you give me the time, so I can give it to you. But they lied to me because I pay $100 per hour, you cannot do it. Why? Time is money. So all they can do, they have to spend time to get the quality work daily basis. Then you can get it. Just like MBA, just like PhD. As long
All
as
the
you have
luck
a
in
good
the
time.
world, all success.
Yes,
Because
as long as
you're awesome.
That's right.
Awesome work.
it's tough. I mean, yes, thank you.
And
very
I
much.
realize the real world, there's a lot of difficult competition because a lot of people are cut rate,
Right.
and you
So
try.
sad.
And, it is.
Everybody say the dental industry.
And
Everybody made a machine. You know what they said? My machine can make your crown for you. So you know what dentist said? I have a $200,000 machine, and then I can mill for you the 2 hours. I look at them. I'm smiling. I look at the other dentist. You will be success because you know why? This guy has a 3 machines, so he spent $300,000. He made a dome crown every freaking day. But this gentleman, they're looking for the good quality, good dentist. He will be success, which is true. But that's very sad. You're right, 100% laboratory. They said, you know what they said? You don't need a good technician. I said, I just look at them. What? Who made the teeth? Oh, my machine made it. Algorithm made it. Okay, piano tools, right? There's no artistry involved.
that's it. Your artistry. You have an eye for
Right.
color and artistry.
And dedicated.
You do, and you do.
Right, and dedicated. And trying to be, I'm standing behind you. I'm not run away. What is this for, right? I'm not like my father. When I was 2, he's gone. They divorced. They gone.
You say this is different, and you're different, and you're going to keep doing what you're doing the best.
100% is right, because that's why it's kind of feel lonely.
That's the difference between
And then-
you learn this. You should learn this somewhere in high school when there are A students, and then there are B students, which are B or C. They're average. Well, there's a bunch of people who are average. In order to be an A student, you got to be different,
Right.
and you get so used to being different that if the majority says this, you look at it and say, that's fine, do what you want, but this is the right thing to do.
It's the right
And
thing
you
to
do
do.
the right thing to do.
Right, and then like I said,
Unfortunately, the world sometimes rewards the majority and not
Right.
the people doing the right thing. But keep doing the right thing.
That's right. We have to tell them. So all my laboratory followers, there's a 6,000 laboratory in North America, and that they have a lot of struggling. So there's a machine involved with tools just like that. I said, don't trust them. Okay, like I said, they want to follow me like that. So follow the naturalism, follow the shape, learn more, just like that. That was the best way. It's not like they're out there. So anyway, so you gave me the motivation,
Thank you.
encouragement.
I'm glad that you did what you did.